Hello, my name is Róisín and I'm presenting the Golden Ticket Patient, which is based on improving efficiencies in orthopaedic trauma theatre. This was a single-site study based in Galway University Hospital, taking place over a 4-week period. GUH is a Model 4 hospital which manages cases in the west-northwest region from Donegal to Tipperary and serves a population of roughly 1 million. It's a specialist trauma centre providing all trauma services with the exception of neurosurgery. Due to the huge caseload, the orthopaedic theatre in GUH is reserved for trauma and select high-risk elective procedures. As a primarily non-elective list, inefficiencies can occur. And as we all know, inefficiencies and delays are hugely important, not only for patient outcomes, but also financially. Delays of just 1 minute can cost as much as €29, translating to over €1,700 per hour. Over the 4 weeks of this study, we recorded the patient's pre-operative progression through theatre. As you can see, the mean time for patients being sent for was at 8:34 a.m. Patients on average arrived at reception and the operating theatre at 8:49 and 9:19 respectively. Anaesthesia was started on average at 9:18 but as late as 10:25, and the mean time for knife to skin was 9:50 but after 11 a.m. on some occasions. Some of the eagle-eyed among you might notice that the anaesthesia time precedes the arrival to the theatre, and this is due to some of our peripheral nerve blocks being performed in the block bay, which is located outside of the operating room in theatre reception. Some delays in this process were felt to be unavoidable, for example prone positioning and neurophysiology monitoring in spinal surgery. However, some of the inefficiencies were identified as being preventable, arising from disorganisation and miscommunication between multidisciplinary teams. We propose the introduction of a golden ticket patient pathway as a method to improve theatre efficiency. Our goal is to have anaesthesia commencement at 9 a.m. in line with elective lists in GUH, and to reduce the knife to skin delays by up to 50%. This would involve the selection of a predetermined first patient on the trauma list for each day. The patient will be seen by anaesthetics the day before their surgery, and any issues optimised as best as possible. All theatre staff required, included radiographers and sales reps, will be informed and available for the first case, and all necessary equipment will be made available. As with any new policy in healthcare, there are caveats to this pathway. Life or limb-threatening emergencies would of course take precedence over the first planned trauma patient, and paediatric cases would continue to be prioritised for the first in the list, in line with GUH policy. After implementing this pathway, we aim to reassess the data. We hope to improve our efficiency and therefore our care delivery as a multidisciplinary team. Thank you for listening.